Hi everyone, I'm Dr. Rajini, consultant gynecologist, lab surgeon from Care Hospital, Banjara Hills. Today we are going to talk about what is breast cancer, what are the symptoms of breast cancer, and what are the treatments available. Breast cancer now is the most common cancer in the world, and it has replaced lung cancer as the most common cancer worldwide. In India, the average age of women who are suffering from breast cancer is 41 to 42 years, compared to 55 to 60 years in the Western countries. Now, women, according to the reports, 1 in 8 women suffer with breast cancer in their lifetime. So it has become a matter of concern in a lot of Indian cities about this breast cancer. How to know they have breast cancer, how to detect it the earliest so that they can prevent this breast cancer. So there is lack of awareness. That is the major problem that I've faced by a lot of people who have this breast cancer. What is breast cancer? Breast cancer is a condition where the normal breast cells which are there in the body, they grow abnormally and lead to formation of masses, which for initial stages they are confined into a smaller size masses, but later on they may develop bigger and can spread to other organs of the body by blood vessels or lymphatics, which we call metastasis. Breast tissue, normally it is composed of lobules and ducts. Lobules are the milk producing glands and ducts are the pathways which connect these lobules and they transmit this milk to the nipple. So the breast cancer can develop in these lobules or ducts. So how to know the symptoms? See, knowing the symptoms of breast cancer is very important so that we can treat at the earliest. Even early detection and treatment has a cure rate of 95%. So early detection of breast cancer is very, very important. To know the early detection, we should understand a common person, a common women, normal people, they should know what are the symptoms of breast cancer. So talking about the symptoms of breast cancer, the most common symptom of breast cancer is a lump, any lump in the breast. If you're feeling any lump, whether it is 1 centimeter, 2 centimeter, 3 centimeters, immediately you have to consult your doctor and get all the necessary tests done. Apart from lump in the breast, other symptoms are being any sort of pain in the breast. See, for a lot of girls, pain in the breast, that is mastalgia, it is common during periods. So you have to observe, is it continuous pain or it is only during periods, and consulting a doctor, getting necessary investigations done and an examination done is very, very important. Talking about other symptoms, if you're feeling if there is a change in the skin texture of the breast, whether if there is any unusual or bloody discharge from the nipples, definitely it is not normal. If there is an inverted nipple or if you see there is any lump in the axilla, underarms, then definitely it is not normal. If you see any sudden change in your breast size or shape, definitely it's a matter of concern. So whenever, if anybody is seeing this pain in the breast or lump in the breast or any discharges from the breast or any change in the skin texture, size and shape, definitely it's an alarming symptoms. Immediately consult your doctor, get an examination done, get all the necessary investigations done for the prevention of this breast cancer. So talking about the stages. See, staging, once you're going to a doctor and getting all the first physical breast examination done, then your doctor may advise you to go for an ultrasound scan or a mammogram. Usually ultrasound scan we do for ladies who are less than 40 years of age, and a mammogram is done usually commonly after 40 years of age. If we see any suspicion, then the next higher level of investigations will be done. So staging of breast cancer is done according to the size and spread of the breast cancer. So there are 5 stages of breast cancer starting from stage 0 to stage 4. So in the earlier stages, that is stage 0, the lump is confined only to the ductules, it has not spread anywhere. And talking about the stage 1, it is any mass which is less than 2 centimeters and is not involved any lymph nodes. And stage 2 is any lump of less than 2 centimeters but has involved lymph nodes or If it is more than 2 centimeters, still has not involved the lymph nodes. And stage 3 is the lump is size of 3 to 5 centimeters, involving 1 or 3 lymph nodes, or involving more than 1 to 9 lymph nodes without any lump. And stage 4 is like advanced, where the breast cancer has spread to other tissues like liver, lung and bones. So definitely this staging is done by the doctor. It's definitely for an idea I have been explaining this. So the further treatment management of any breast cancer depends on the stage of this breast cancer. So the first and foremost thing what we do to diagnose whether it is a benign or malignant condition is doing a simple biopsy. By biopsy, we know what cells are there in the lump. Is it a benign tissue or it is a malignant tissue? So further investigations required, maybe a mammogram or a CT scan. Sometimes your doctor may advise your whole body PET scan to see the extension of the breast cancer tissue and whether it has metastatized to other organs or not. So there are a lot of treatment options available these days. So it may include surgical treatment, radiotherapy, hormonal therapy or chemotherapy, and targeted therapies. So any treatment depends on the stage of cancer. So previously, in a long back, treatment included any breast cancer treatment included mastectomy, that is removal of the entire breast tissue. But there are a lot of recent advances. Technology has developed so much. These days, mastectomy is not done for every lump. There are a lot of breast conservative surgeries have been coming in the latest technology. So sometimes the patient may need a simple lumpectomy. The surgeon who is operating, the oncologist who is operating, may do a simple sentinel lymph node biopsy to see which lymph node is affected, and only that particular lymph node will be removed and not removing the entire lymph nodes and preventing other complications. So a lot of technological development has come, and targeted therapy, immunotherapy. So depending upon the stage of your cancer, what stage you are, the treatment depends on that. So this is a treatment part. How to prevent it? See, breast cancer, now it has become the most common cancer. How to prevent for a normal woman who is in a reproductive age group or adolescent or a elderly lady. So these people, they should be very much aware. So I advise all the patients, get an annual checkup done. So for the ladies starting from the reproductive age group, you get an annual checkup done. Those ladies who have a family history of breast cancer, definitely they have to get an annual checkup done. Get your breast examined by your doctor, your gynecologist or whatever, your family doctor. Get a breast examination done, get an ultrasound scan done, and have a good screening. We have got lot of screening techniques and technologies available these days where breast cancer can be detected at the earlier stages. So my advice to all ladies is get an annual breast checkup done and self breast examination, screening of breast cancer, and whenever you're having any suspicious lesion, definitely immediately consult your doctor, get the necessary investigations done. And if you're diagnosed with malignancy or breast cancer, just don't panic. There are a lot of technologies available these days. Lot of breast conservative surgeries are available these days. So choose your doctor properly and get the appropriate treatment for your breast cancer. Thank you.